Welcome to Badger Talks Quick Picks, which brings exciting happenings, resources, and talent from your UW flagship campus to the people of Wisconsin and beyond, demonstrating the power of the Wisconsin idea, one connection at a time.
Hello, and welcome to Badger Talks Quick Picks, which brings exciting happenings, resources, and talent from your UW flagship campus to the people of Wisconsin and beyond. My name's Adam Gepner, and I am so excited to be talking to you about how to love your aging heart because we really need to care for our most precious Valentine. So, what are you doing right now? Right this very second? Well, maybe not this second, but what are you going to do today to make sure that you're staying healthy as you age? And that's going to look different for everyone. But I think if we're thinking about it, it's the first step to making sure that we're doing everything we can to be our best, most vibrant selves. Because aging really does matter. We are living longer, and because of that, as we get older, people develop more medical conditions and comorbidities. People are prescribed new medications. There's also perceptions about how we may be too old for certain invasive procedures. And there's also societal attitudes about who should be getting aggressive care and who shouldn't be. And this slide just shows that over the next 20 years, it's projected that more and more people are going to be in the 65 and older age group. And we're going to have nearly 30 million people by 2050 in that 85 and over age group. And there's no surprise. If more people are having heart attacks, more people are being hospitalized for heart-related conditions. So you can see again in this slide, which shows the number of hospitalizations for cardiovascular diseases. It doesn't matter if you're a man or a woman. As we get older, the number of hospitalizations for heart disease-related events continues to increase. And I want to remind you that really prevention is the key. A lot of people, you may not have heart disease. We want to make sure that you don't develop heart disease. And there are people out there who have heart disease, and we want to make sure that you don't have more heart attacks or heart-related problems. And so it's very important to treat robust, community-dwelling older adults similar to younger adults. So we need to be screening for cardiovascular disease, and this includes if you go to the doctor with problems, them asking you questions about your heart-related health and symptoms related to your heart. We need to be aggressively screening for and treating risk factors. And risk factors for heart disease, the primary risk factors include high blood pressure, high blood sugars or diabetes, and high cholesterol or dyslipidemia. And we need to pay attention to the increased risk for adverse effects, particularly related to either aging or medication use as we get older. And this should be a shared decision with your provider. So again, your goals, your life, what you want out of life matters. So screening and prevention and treatment should all align with your goals and your preferences. I always tell my patients, I know a lot about cardiology, I know a lot about medicine, but you know a lot about you, and we need to find that middle ground. And what about some of us who are getting older and may have limited life expectancy? If we have a life-limiting illness like cancer or end-stage organ failure, that's going to also impact how we make decisions about preventing and treating cardiovascular disease. Unfortunately, we don't have as much time as I'd like today, so we can really only focus on one area of cardiovascular risk prevention. And I picked high blood pressure. So I'm wondering, do you have high blood pressure? Maybe you do, maybe you don't, but I guarantee you know somebody if you don't who has high blood pressure. Because high blood pressure, yes, the dirty truth, and I hope you can handle the truth, is that heart disease is the #1 cause of death in the US. This may not surprise you, but what might be of interest to you is the #1 modifiable risk factor for heart disease is, yes, hypertension or high blood pressure. So we have to be thinking about it and we have to be treating it. And millions of Americans are 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 have this problem and are being treated for this problem every single day. In fact, over 100 million Americans and far, far more individuals worldwide have hypertension. And this was something that came up a few years ago when there was a big change in how we decide how aggressive to be with blood pressure goals. So what does that leave? That leaves lifestyle for all those other millions of Americans who didn't need medication. So just a little primer, what is blood pressure? Well, blood pressure is when fluid or blood gets pushed into our blood vessels. It's the force against the artery wall that we're measuring. So, what's the difference between high blood pressure and hypertension? Great question. High blood pressure can be completely normal. If you're exercising or you're doing something active or you're in a stressful situation, blood pressure should go up. It should rise to allow your body the physiologic necessities to do the things that you need to do. Hypertension, a diagnosis of hypertension, is when we lose that regulatory control. In other words, our blood pressure is high when we're at a resting state, and when we're doing something that needs more blood pressure, the blood pressure is abnormally high for that. I always give the example of if you're being chased by a bear and you're on fire, you should definitely have high blood pressure at that time, but that doesn't mean you have hypertension. This condition is also ubiquitous. 45% of US adults have it. I work at the VA, and over 1/3 of veterans have a diagnosis of hypertension. And just like cardiovascular disease and hospitalizations, as we get older, the prevalence increases. And by the time we reach 60 years old, 65% of people over age 60 have a diagnosis of hypertension. And again, just like the heart disease and stroke statistics I showed before, it doesn't matter if you're a man or a woman, everyone is affected by hypertension. It's a ubiquitous disease. The top number and bottom number can sometimes be confusing. The top number is the systolic pressure, and that's when the pressure in the blood vessel when your heart is contracting or pumping blood out of the heart. That's called systole. The bottom number is this diastolic pressure, which is when the heart is relaxing and the heart cavity is actually filling with blood. And typically, we think of the ideal blood pressure as 120 over 80 millimeters of mercury or lower. I'm a cardiologist, and so typically I tend to work with people who have a lot of cardiovascular disease risk factors. And my read on the evidence is that the lower you can get your blood pressure, the better. So if you can get under this 130 millimeter of mercury systolic goal, that's ideal for your cardiovascular health. But we don't want to do that at the expense of side effects. So remember that first question, what are you doing now to stay healthy as you age? Well, I'm hoping to give you at least 4 things to think about in terms of their relationship to blood pressure. And these big 4 are really the key to prevention. And that's focusing on improving obesity, our diet, substance use, and increasing exercise. Weight loss is so critical for a lot of different medical conditions, including heart disease and hypertension. For every 1 kilogram of weight you lose above your ideal body weight, you can decrease your blood pressure by 1 millimeter of mercury per kilogram systolic. And lastly, if you want to lose weight, a lot of times you're working on exercise, and it does not matter what type of exercise we're doing. Um, we know that if you're doing 150 minutes a week, you're going to lower your blood pressure. And again, aerobic, weight training, whatever you like to do, it doesn't matter. There's lots of ways to exercise and get our bodies moving, but remember, especially if you're older, start slow, work with your physician if you have medical conditions, and there's a lot of groups out there who focus on exercise for older adults. Thank you so much. We'd love to hear what you thought of this presentation and are open for questions and comments.